Assalamualaikum everyone, this is RPHVR and welcome to the platform of Pharmacology once again with a new video of the drug series, that is aspirin. Aspirin is analgesic, so we are covering the analgesic drug and this is the second drug of the analgesic series. So let's begin the video. Aspirin is a acetylsalicylic acid, the prototype converted in the body to salicylic acid, that is an oldest analgesic because it is a prototype. Other important salicylates include the sulfasalazine, diflunisal, and the natural sources are fruits, vegetables, herbs, spices, and nuts and tea. So as you can see at the right hand side above, this is the basic structure of the aspirin. Now the pharmacological points of the aspirin: it is a weaker analgesic than morphine, 600 mg versus 60 mg codeine. That means 60 mg codeine is equivalent to the 600 mg when we compare its analgesic property. Now aspirin is an irreversible inhibit COX-1 and COX-2 activity, and this is the unique character of this drug because all of the other NSAIDs are reversibly block this activity. It inhibits the COX irreversibly by the acetylation. Fresh enzyme synthesis required for return, mainly affected in pain because it is analgesic, related to inflammation because it is anti-inflammatory, tissue injury, connective tissue, and the other type of the pain, that is a integument pain. Not much affected in the visual and the ischemic pain. Mechanism: prevention of the PG mediated, that is a prostaglandin mediated sensitization of the nerve, and other mechanisms include the raising of the pain threshold by acting centrally, morphine-like, but no sedation because obviously morphine is an opioid, so that's why it is having the sedative effect. But aspirin is not an opioid. Subjective effect: tolerance or physical dependence, resetting of hypothalamic thermostat, fever reduction. That's why it is antipyretic. So that is the basic reason. Anti-inflammatory doses are higher than analgesic doses. So this is basically the mechanism of action. Here you can see the aspirin inhibit the COX-1 synthesis and it is also inhibit the COX-2 synthesis. So ultimately there is no PGs. When there is no PGs, so there is no pain. So what is the basic mechanism of action of the aspirin? Aspirin is a weak organic acid that irreversibly acetylates the cyclooxygenase, as I described in the previous slide. The other NSAIDs are the reversible inhibitors, so that's why it is a unique character of the aspirin. The NSAID including aspirin having the three major therapeutic action, that is anti-inflammatory, analgesic, and the antipyretic effects. So what are the pharmacological actions? Metabolic effect: increase cellular metabolism, uncoupling of the oxidative phosphorylation, increase heat production, increase utilization of the glucose, decrease blood glucose or the blood sugar, and glycogen depletion. Negative nitrogen balance: increase protein to carbohydrate. In the respiration, at the low dosage, it increased the carbon dioxide, stimulate the respiration, increase sensitivity of the respiratory center to carbon dioxide. In poisoning, direct stimulation of the respiratory center, so that's why it causing the hyperventilation. At the higher doses, depression of the respiratory center lead to the death due to the respiratory failure because of the depression of respiratory center in the high doses. Now in the case of the GIT, what is the effect of the aspirin on the GIT? So it is basically irritant to the mucosa, that's why it's causing the nausea and vomiting. Obviously this is the common adverse effect of all the drugs, but you should know the reason. So here the reason is written in the picture: irritant to the mucosa, unionized in stomach and absorbed, but upon absorption ionized and indiffusible. Locally back diffusion of acid causing the necrosis of the mucosa and arteries, ulceration, and erosive gastritis. So these are basically the adverse effects and the effects of the aspirin. occult blood loss, and salicylate induced gastric bleeding is painless and may lead to the iron deficiency anemia. Why it causing the gastric bleeding? Because it is irreversible in nature. That's why it's causing the salicylate induced gastric bleeding. Now, in the case of the CVS, what is the effect of aspirin on the CVS at the therapeutic dosing? Have no significant cardiovascular effect. High doses increase BP. Why increase BP? Because of increased cardiac output and the peripheral vasodilation by the exerting a direct effect on smooth muscle. Toxic doses depress circulation directly and by central vasomotor paralysis, CCF, low cardiac reverse patient. Now, in the case of the hematological effect, because it inhibits the COX pathway, that's why it inhibits the platelet aggregation by decreasing the production of the thromboxane, because thromboxane is the product of cyclooxygenase. Last for a week in dose greater than 6 grams per day. Aspirin may reduce plasma thrombin level. Prolonged use decrease in synthesis of the clotting factor, urate excretion. Dose less than 2 grams per day, urate retention. Now 2 to 5 grams per day at the variable effects is producing more than 5 grams per day, increase urate excretion. So what are the contraindications of the aspirin? That are the sensitive persons. So if you are hypersensitive with aspirin, so don't dare to take this drug. Children with a viral disease, peptic ulcer disease, and bleeding disorder. Why bleeding disorder? I think you should know the reason. Kindly tell me no in the comment box. Chronic liver disease, diabetic, CHF, and the rheumatoid arthritis, G6PD deficiency. Stop prior to the surgery, near-term pregnancy, breastfeeding mothers, and many of the reasons having the same justification. Now these are some drug interaction. Aspirin with the probenecid, because it antagonizes the uriconic action of the probenecid. Probenecid become ineffective in the gout. Aspirin and the oral anticoagulant, that are the warfarin and sulfonylurea, because it increases the chances of toxicity. Aspirin and antihypertensive. Why? Because you can easily interlink with its CVS effects. As it causes fluid retention and edema. Antihypertensive effect decreases. Aspirin and diuretics. Diuretics, that are the loop diuretics, and thiazide, that are the furosemide and thiazide respectively. So that's all with this drug and with this video. Inshallah, meet with a new drug and with a new video of the Analgesic 3 very soon. Till that, take care. Allah Hafiz.